Shoulder pain, it's one of the most common things that sends us to the doctor. But man, can it be confusing? Is it a tear, arthritis, something called impingement? It's a lot. So today, we're going to pull back the curtain and show you exactly how doctors approach this. We're going to walk you through their playbook for getting to the bottom of shoulder pain.
All right, to get us started, let's look at a super common scenario. You've got a 58-year-old guy, his shoulder hurts when he lifts his arm, and the doctor says you have subacromial pain syndrome. So what's the very first thing that should be done for treatment? Have a think about that, because by the end of this, you're gonna know the solid evidence-based answer. So here's our roadmap for today. We're breaking this down into 5 parts. First, we'll look at how doctors even start solving the puzzle. Then we'll cover the really serious stuff, the red flags they look for immediately. After that, we'll dive into the doctor's toolkit, meet the most common culprit behind shoulder pain, and finally map out the road to recovery.
Okay, let's jump in. Section 1, solving shoulder pain. I want you to think of your doctor as a kind of detective here. They're not just taking a wild guess. They are methodically following a trail of clues that leads them from what you're feeling all the way to a final diagnosis. And all this detective work is absolutely necessary because, well, the shoulder is just incredibly complex. Seriously, it's not weird at all for someone to have 2 or even 3 different things going on in there at once. And because of that, doctors have to use a systematic approach. And step 1 is always about safety first, making sure nothing really bad is being missed. Which brings us right to our second part, spotting those red flags. Before a doctor does anything else, their number 1 priority is to check for any urgent, serious issues that need immediate medical attention. So, what kind of red flags are we talking about? Well, if a joint is hot, red, and swollen, that screams infection. If the shoulder looks kind of misshapen after an accident, that points to a dislocation. A new lump could, in rare cases, be a tumor. And any sudden, dramatic weakness or loss of feeling could mean a big, acute tear or even a nerve injury. You see any of these, and it's an immediate, same-day trip to the hospital. No messing around.
Okay, so once all those urgent issues are ruled out, the real detective work begins. And for that, the doctor breaks out their primary care toolkit. And it really boils down to 2 main things: asking some very specific questions, and then doing a series of hands-on physical tests. The questions might sound simple, but they are incredibly revealing. For instance, asking, "Can you lie on the affected side at night?" That's a fantastic way to figure out how severe the pain really is. If you actually can sleep on it, the issue might be something that can be managed with a wait-and-see approach. Then they'll want to know this: do you have pain when you're just sitting there or only when you're moving? See, a constant ache, even at rest, often points to a problem deep inside the main ball and socket joint, something like a frozen